My name's Charles Pegelow. I'm a retired structural civil engineer. I've worked in high-rise office buildings, a lot in the offshore industry. Before I started all these problems, I had never heard of peripheral artery disease. I noticed that my left calf was feeling like it was cramping, and I didn't know why. It didn't make sense.
A lot of patients don't understand what they have. They dismiss their diagnosis as arthritis.
Well, as it progressed, he could no longer do the work on the rent houses. He did a lot of the work himself, with the crawling up ladders, getting on the roof, and things like that. He couldn't do that anymore.
Well, I got the first stent in, and it worked fine, but about a year and a half later it blocked up again. So I went in, and my cardiovascular doctor cleaned that out and then put another stent in, extended it, and that lasted for about another year and a half till it blocked up again. So they recommended I get a bypass, which is from the groin to the knee. After that, I got decent flow, and but the problem is that thing blocked up after a year and a half. I woke up in the middle of the night, and apparently that's when the sudden blockage had occurred, and my foot just felt dead. And when I mean dead, I couldn't even move my toes.
Once it starts to involve the nerve function, which means numbness or inability to move your toes, that is almost at the end stage. So that is at the point where you could possibly lose your leg.
Well, his cardiovascular doctor here that put in all the stents, he said, "Charles, I've done all I can for you." He said, "I've used all the tools in my toolbox, and I don't know where else to tell you to go."
So that's when I decided to really start some very serious investigations to see what was out there.
And he said, "Come here, I want you to see this YouTube video." And he said, "There's this doctor that can clear a blocked artery in just an outpatient procedure." And he said, "This is it. This is what I need."
When I saw Mr. Pegelow, he was having significant amount of pain at rest without even doing any kind of activity. This made me think that his disease had progressed quite significantly.
After I stumbled across Avenger products, I was really impressed with it. And the reason I'm impressed, it gives the physician an instant, real-time, three-dimensional view, whereas your normal contrasting fluid with X-ray only gives you a two-dimensional view. It's like looking at a river from space. You can see how wide it is, but you don't know how deep it is. But in here, it's like you're in a submarine going down the river, and you can see where you are, how far you are from the edge. You don't hit the bottom, or you don't surface. The physician could get real good control of not hitting the wall of the artery and punching a hole through it.
If you disrupt the normal part of the artery, then you're going to increase your chances of that blockage coming back. The unique thing with the Lumivascular technology is you can see inside of the vessel as you're treating the artery. So the great thing about that is not only can you remove just plaque, and so you know exactly what you're removing, but then you can avoid damaging normal tissue. You can't do that with any other technology.
The next day, my wife and I went down to the drugstore or Walmart, and I was able to walk in and, fine, slow but fine. And so I wasn't feeling any problem in my leg. And at that point also, I noticed that night that my foot was very warm. In other words, I knew it was getting lots of blood supply down in my foot.
Once you open up that blood vessel, you suddenly have fresh, new blood with nutrients and oxygen coming to the foot.
If someone came to me and said they had peripheral artery disease, other than things like diet and exercise and stuff like that, I would suggest going and there's a number of procedures that can clean it out. And first of all, with a CTO of chronic total obstruction, I think this Ocelot is the best thing out there. And as far as just cleaning out arteries, I like the idea behind the Pantheris where they can shave a layer, bad layers off, and they can actually pull it out of your vein.
I couldn't believe it. I mean, we walked in the hospital, had the procedure, we walked out. It was just a miracle.